Introduction. Hydrocephalus is a condition characterized by the abnormal accumulation of cerebrospinal fluid (CSF) within the brain's ventricles, which can lead to increased intracranial pressure (ICP) and progressive neurological deterioration. In veterinary medicine, internal hydrocephalus, particularly congenital, is a common malformation affecting dogs and cats. It presents as either primary, linked to congenital malformations, or idiopathic, where no clear underlying cause is identified. The etiology of hydrocephalus is heterogeneous. It can result from various pathological entities, including primary brain malformations like aqueductal stenosis or cyst formation, as well as secondary causes such as intracranial tumors, infections, or hemorrhage. Many cases remain idiopathic when no identifiable pathology is found. Untreated, hydrocephalus can lead to clinical signs including ataxia, behavioral abnormalities, blindness, vestibular dysfunction, and potentially death. The preferred treatment for managing internal hydrocephalus in veterinary patients is ventriculoperitoneal shunt (VPs) placement. VPs diverts excess CSF from the cerebral ventricles into the abdominal cavity, where it is absorbed. This method has long been established in human medicine, but its use in veterinary practices is still evolving, with the procedure facing challenges including high rates of shunt malfunction and failure. This review provides a comprehensive overview of ventriculoperitoneal shunting techniques, applicable hardware, and associated complications in the treatment of hydrocephalus in dogs and cats. The discussion also focuses on prevention and management strategies for shunt failure, which remains a major obstacle in the successful treatment of hydrocephalus. Surgical technique and equipment. The primary aim of ventriculoperitoneal shunting VPs is to redirect the excess CSF from the lateral ventricles in the brain to the abdominal cavity. While different shunt systems have been developed, all function under the same basic principle. However, they vary in some components based on specific needs. Shunt system components. 1. Ventricular catheter, a flexible silicone tube, which is inserted into the lateral ventricle of the brain to drain CSF. This catheter typically includes a mandrel to prevent kinking during implantation. The drainage segments are marked with holes to allow for CSF collection. The number and distribution of these segments can vary, with fewer drainage holes used in systems designed for smaller animals like cats or small breed dogs, to prevent complications from contact with the cerebral parenchyma. 2. Shunt deflectors. These devices prevent the catheter from kinking as it exits the burr hole during implantation, while ensuring that the depth of catheter insertion is maintained. 3. Reservoir, a key component of the system. Reservoirs are generally dome-shaped and consist of a solid base and silicone dome. Pressing the dome allows for sampling of CSF or to check the functionality of the shunt. Some systems incorporate a non-return valve, which prevents backflow of CSF during manipulation of the reservoir. 4. Pressure valves. These valves are crucial for regulating CSF drainage. They are designed to open when the ICP exceeds a set threshold, thereby draining excess CSF and closing once the pressure drops below that threshold. These systems typically employ a ball and spring or diaphragm mechanism to manage flow. Pressure valves are classified based on their opening pressure, low pressure 0-5 cm H2O, medium pressure 5 to 10 cm H2O, high pressure 10-15 cm H2O. 5. Gravitational valves and antisiphon devices. These components prevent excessive CSF drainage, especially when the animal is in an upright position, a phenomenon called overshunting. Gravitational units, when activated by postural changes, increase valve pressure to prevent overshunting. 6. Programmable shunt systems. Although rarely used in veterinary medicine due to their cost, these systems allow for non-invasive adjustment of the pressure settings using external magnetic devices. This gradual adjustment helps determine the optimal pressure setting for each individual animal. 7. Flow-regulating shunt systems, designed to limit the total volume of CSF drained. These systems increase hydrodynamic resistance as the CSF flow increases. While commonly used in humans, their benefit is limited in small animals, as the regulated flow volume, 5 ml/hour, exceeds normal CSF production rates in dogs and cats. Indication for surgery. Hydrocephalus is typically diagnosed via imaging studies, with magnetic resonance imaging (MRI) being the gold standard. The condition is easily recognizable in neonates due to craniofacial dysmorphia and doming of the calvaria, but it can be more challenging to diagnose in adult animals, particularly brachycephalic breeds that naturally have larger ventricles. While enlarged ventricles ventriculomegaly do not always correlate with clinical signs, they may reduce cerebral white matter and perfusion. It is critical to distinguish hydrocephalus from ventriculomegaly, which is often asymptomatic. Other conditions, such as meningoencephalitis of unknown origin, MUO, must also be ruled out, especially in small brachycephalic dogs. Infections, such as feline infectious peritonitis (FIP), which cause choroid plexitis or ependymitis, may mimic hydrocephalus and must be excluded before considering VPs. The decision to place a VPs is based on a combination of clinical signs, MRI findings suggestive of increased ICP, e.g., tetraventricular hydrocephalus, paraventricular edema, and the absence of inflammatory disease. Dogs or cats presenting with obtundation, nystagmus, or circling behavior, combined with these MRI findings, are prime candidates for VPs. Pre-surgical considerations. VPs is typically delayed until the animal is at least 6 weeks old to reduce the risk of complications from anesthesia and to accommodate growth. Shunt placement requires careful preoperative planning. MRI is crucial to measure the ventricle dimensions and determine the optimal insertion point for the ventricular catheter. Skull morphology, especially in brachycephalic breeds, presents challenges during surgery. These animals may have open fontanelles or unossified cranial sutures, complicating the proper placement of the shunt. Measurement of ICP is recommended when feasible, as it helps select the appropriate valve pressure. Although this is not available in all veterinary centers, clinical signs such as head tilt, ataxia, or nystagmus may indicate elevated ICP and guide valve selection. Shunt-associated complications. The most common complications associated with VPs include shunt obstruction, overshunting, and infection, all of which may require surgical intervention or shunt revision. 1. Shunt obstruction. Obstruction remains the most frequent cause of shunt failure. Inflammation caused by the foreign material of the shunt can lead to debris formation within the catheter lumen, obstructing CSF flow. In humans, flow studies are routinely conducted to locate blockages, but this technique is less commonly applied in veterinary medicine. The ventricular catheter is most commonly obstructed in dogs and cats, usually by cellular debris or parenchymal tissue. Positioning the catheter appropriately is essential to prevent contact with the brain parenchyma, which can cause blockage as the brain tissue encases the catheter postoperatively. Shunt patency can be monitored by compressing the reservoir. A lack of refilling suggests obstruction, necessitating catheter replacement. 2. Overshunting. Overshunting occurs when too much CSF is drained, causing underpressure in the ventricles. This can lead to tensile stress on the brain tissue, resulting in subarachnoid hemorrhages, hemispheric collapse, and potentially fatal brain herniation. The use of gravitational valves to prevent overshunting is controversial in veterinary medicine, due to the quadrupedal posture of animals, which differs from the upright posture of humans. 3. Infection. Shunt infections, though less common in veterinary patients, 4.1%, are a significant concern. Most infections are caused by skin flora, such as Staphylococcus pseudointermedius, which colonizes the shunt surface. Infection can result in shunt blockage and necessitate removal. Unlike in humans, antibiotic-impregnated shunt tubing is rarely used in veterinary patients, but when infection is suspected, antibiotics should be administered, and the shunt should be replaced. Postoperative care and follow-up. Postoperative monitoring is crucial for detecting complications early. Clinical improvement typically begins within the first 24 hours post-surgery, with signs such as obtundation resolving quickly. Cerebellar and vestibular dysfunction may take several days to improve. A follow-up MRI is recommended 3 months post-operatively to assess ventricular size and parenchymal reconstitution. If clinical signs persist despite a patent shunt, a lower pressure valve may be considered. However, in cases where ventricular volume has decreased but clinical signs persist, brain atrophy or permanent damage may be the cause, and further surgical intervention may not be beneficial. Medical therapy. Medical management of hydrocephalus with drugs such as prednisone, acetazolamide, and omeprazole has limited efficacy. These drugs reduce CSF production by altering ion transport and osmotic balance but are generally used as a temporary measure until VPs can be performed. Omeprazole, shown to reduce CSF production when administered intravenously in dogs, but oral administration is largely ineffective. Acetazolamide, although it reduces CSF production, long-term use leads to resistance due to compensatory increases in ion transporters. Glucocorticoids, e.g., prednisone. The efficacy of steroids in reducing CSF production is unclear, and their effect is likely limited to reducing edema and inflammation. Alternative surgical techniques. While ventriculoperitoneal shunting remains the gold standard for treating hydrocephalus, several alternative procedures have been described. Ventriculoatrial shunting, ventriculopleural shunts, and ventriculoreteral shunts are among these alternatives, although their use in veterinary medicine is rare due to the risk of complications such as venous thrombosis. Endoscopic third ventriculostomy, ETV, commonly used in human children, is another promising technique that may eventually be applied to veterinary patients. This procedure creates a bypass between the third ventricle and the subarachnoid space, allowing CSF to flow freely without the need for a shunt. However, the feasibility of ETV in veterinary patients remains to be determined. Conclusion. Surgical management of internal hydrocephalus in dogs and cats continues to evolve. Ventriculoperitoneal shunting remains the most effective treatment, though shunt-related complications like obstruction and overshunting present ongoing challenges. Advances in shunt technology, including the development of programmable and flow-regulating shunt systems, may improve outcomes, but proper patient selection and surgical technique are critical to minimizing complications. Future research into alternative techniques like endoscopic ventriculostomy and the development of veterinary-specific hardware may further refine the management of hydrocephalus in companion animals.